Hello, this is Dr. Kshitij Kumar, General Physician and Diabetologist. Our today's session is all about blood pressure and dyslipidemia, and about a bit we will talk about heart disease also. So generally we see a lot of patient which is coming in our clinic or in our hospital regarding their high blood pressure. So we should know all the basics and learn about what is actually blood pressure. Blood pressure, as we are all aware, that our heart generally pump 24 into 7 and which is a very crucial part in our whole body, and which regulates our blood in our stream. So generally how we diagnose blood pressure is systolic blood pressure, that is upper part of blood pressure, is 120, and diastolic pressure, which is lower part of the blood pressure, is 80 mmHg. So generally we say 120 by 80 is a normal blood pressure unit of a healthy person. Once the person are having more than 140 by 90 mmHg of a blood pressure, generally we called it a higher blood pressure. And if any patient with persistent of a higher blood pressure will have a serious heart condition in future, we should always know, and we should always check in any clinic or in our hospital, or to go to any physician to check your blood pressure regularly, at least once in a month. And basically the cause of a high blood pressure is which we can see are many risk factor for the hypertension, that is higher blood pressure, is age. When we are getting old, 60 plus, our generally blood vessel getting loosen up and cause a higher blood pressure. Or sometime when we having a family history, suppose our parents, mother, father in our family having hypertension already, there is a lot of chances that their son also are having blood pressure. And when in our diet, generally when we take a lot of extra salt, that is also one of the main cause of having a higher blood pressure. And eating processed food or having a junk food in our day-to-day life, that also contribute, unhealthy lifestyle that contributes to rising up a blood pressure, higher blood pressure. So what I would suggest you, that we should always finalize, and once we got to know that we are having a higher blood pressure, we should be taking a lot of precautions to maintain it. Otherwise definitely in some day you will get a complication because of higher blood pressure. So we should always quit smoking if you are smoking, because that is totally not good for your heart. So if anybody is taking or smoking, you should quit it. And if there is a excess of alcohol, that is also you need to cut in your lifestyle. Or you should, if you are having stress, you should reduce it, because directly or indirectly it will help you to risen up your blood pressure and it will contribute on your health. So it is all about hypertension. So now we will talk about cholesterol. And cholesterol is also playing a major contribution in our life. Cholesterol generally, there is a different values, total cholesterol, triglyceride, LDL, HDL. So when total cholesterol level is more than 200, generally we say that patients are having a high cholesterol, and we should always take precaution at that time, and we should always start having some form of medicines, or you should change your lifestyle. You should do exercises. You can do morning yoga. 30 minutes walk is good for your health, which can reduce your cholesterol level as well, and your blood pressure also will be low. So whenever we go to see any doctors for a high cholesterol, if they advise you to have the medicine, you should regularly take it. You don't miss it, because that is very precious, and somehow it will affect your heart. And the medicine which we call the statin, in the market we can see a different kind of tablets, and you should regularly take it as depend on your cholesterol level, the doses, and the stress play a very important role in your body. So we should also try to avoid uh, stress level. So we will now try to understand heart attack because of any reason, any cause. So now we all aware that these days what are the symptoms. It is very familiar. Heart attacks once we get when there is a severe chest pain which is radiating towards your arm and towards your jaw, and when you feel that there is a low oxygen in your body and you start feeling breathlessness. So these are signs and symptoms which you can get some sense that you are having some kind of heart problem, and you should concern immediately to your doctors, or you can go to the hospital because prevention is always better than cure. So whenever you will feel you just immediately need to go to the hospital, you just run over there and you just get your ECG done. The main factor of having a heart attack is, as I mentioned a few seconds before, is higher cholesterol. So again I am focusing about the cholesterol. We should always regularly check our cholesterol level in our body, because once there is a high cholesterol, there is always a danger sign and having a higher risk for having a heart attack. Actually, there is a two kind of cholesterol in our body. One is good for our health and one is bad for our health. And so one cholesterol which is bad for our health is getting increased in our body, in our vessels. It started attaching in our blood vessels, and in a period of a time it totally block your veins, and this is one of the main reason erythroscleroderma, which we called in our medical practice. Because of that we are having a heart attack. So generally whenever you will feel any kind of sign and symptoms, you just need to consult your doctor and need to visit hospital. So whatever we have talked, our basic motto supposed to be in our life is a healthy lifestyle. Healthy lifestyle can correct a lot of diseases in our body. Our blood pressure, our cholesterol level, our sugar level, we should always try to control. If patients are having diabetes and blood sugar is more than 200, we should always keep it in a normal range, because it affects our body. So we should always try to control our diabetes in our life. End of this session, I would like to tell you few points about regularity and which we need to check in our day-to-day life, about our basic health checkup routine, which we all supposed to be get it done at least once in a year. That is very useful, and that will tell you previously if we are having any kind of developing diseases which we are not aware of. First of all, we should always check your blood pressure. If you don't have any device, you can get it from some local pharmacy also. Now these days it is available everywhere. You can, if you are not be able to go to the hospital or any clinics, you can buy at from pharmacy and you can get it done. It is very easy. What you need to just check is blood pressure above supposed to be less than 120, and below, which is diastolic, supposed to be less than 80 mmHg. Once if it is more than 140 by 80 mmHg, you just need to concern or go to any physician or clinician. And so monitoring your blood sugar is very crucial, and we should get it done at least every once in a month. And the second most important point is checking blood sugar. And blood sugar we can check through fasting blood sugar or postprandial, I mean after having breakfast, and then after 2 hours you can get it done. So one is fasting, one is postprandial blood sugar. which can tell you the exact amount of how much sugar is in your blood on that particular day. Second, we can get HbA1c done, which HbA1c is also very important to figure it out about your sugar level in your body. HbA1c generally tells you about your last 3 month previous RBS blood sugar values. They can sum up and they can tell you the average blood sugar through HbA1c. And third is oral glucose tolerance test, OGTT, that will also give you information about your blood sugar. And third, which we need to check at least twice or thrice in a month, is our total cholesterol level, which I have already mentioned. There is in total lipid profile, which we can see total cholesterol, triglyceride, LDL, HDL, VLDL, which can give you idea about the cholesterol which is in your body. So this is very basic test which you need to get it done at least once in a year for your heart, for your diabetes, and to have a general checkup, and which will be very beneficial if any person is getting or developing any kind of disease. It is very easy to diagnose through that all these tests. Today's our session is all done. Thank you so much.